My name is Annette Patellos. I am an RN and I am the Director of Cardiovascular Services. It's so important that people are heart healthy, primarily because you only have one heart. So if you don't do it right, you're going to feel the effects for a lifetime. Coronary and heart disease can be diagnosed early on, even into people's teens to their early 20s. So if you start out doing screenings and seeing a physician earlier on in your life, that way you're not having to worry about something that you might not be able to reverse because damage has been done. So prevention is the best cure with heart disease. What's important to know is family history, genetics, to try and have a healthy diet so you're keeping a close eye on cholesterol levels. Most men are not good about listening to symptoms that they may have about a heart attack or possible stroke. Women are just as susceptible. In fact, it was the leading cause of death for women 2 years ago. So a heart attack actually occurs in the United States every 4 seconds. If you have chest pressure, if you have elevated blood pressures that don't seem to come down, it isn't just specific to having left arm pain. I actually took care of a patient once that had pain in their foot, and they ended up having a heart attack. Strokes are related to heart disease in that if you have elevation of blood pressure that's not controlled either by diet or medications. We have a full-service cardiac line here. We do diagnostic cardiologists, so if it's an ultrasound of the heart called an echosonography, or if it's getting on a treadmill to stress the heart to see how well it does to exercise, that is the first step in coronary screening. The next would be if your physician recognizes something that's not right and they need to get a better perspective, the possibility of going and having a nuclear scan done or to have a diagnostic cardiac catheterization. And that's where we can actually inject dye into the coronary arteries by a cardiologist to see if there's any blockage in the coronaries. So we have cardiologists that work primarily at Castle, and you can always go to our website at adventisthealthcastle.org to see the subspecialties and physician services all the way up to cardiac surgery.
This segment is sponsored by Adventist Health Castle.